Respiratory 103, Chapter 4. Diffusion. Dalton's law of partial pressures states that a mixed gas's pressure is equals to the sum of each individual gas's pressure. Henry's law states that the amount of gas that will dissolve is proportional to its partial pressure. Because of this, during blood gases, patients with high temperatures can cause high O2 and CO2 readings. Fick's law states that the rate of gas transfer across tissue is proportional to the surface area, the diffusion constants, and the difference of partial pressure on either side of the tissue. Also, the transfer is inversely proportional to the thickness of the tissue. Graham's law states that the rate of diffusion is inversely proportional to the square root of the molecular weight of the two gases. Simply put, lighter gas equals quicker diffusion. Graham and Henry's law together display that CO2 diffuses 20 times faster than O2. The partial pressures of the atmosphere. If 100% equals 760 mmHg. Nitrogen, which is always 78%, equals 592.8 mmHg. Oxygen, which is always 21%, equals 159.6 mmHg. CO2, which is always 0.03%, equals 0.2 mmHg. And other, which is always 0.93%, equals 7 mmHg. Pressure varies with altitude and depth. The higher above sea level, the more the pressure goes down. And the farther below sea level, the more pressure goes up. When going below sea level, every 33 feet equals plus 1 atm or plus 760 mmHg. Here is a picture showing the difference in atmospheric pressures. In the pressure gradient, one gas goes from high to low. This is the primary mechanism of ventilation. In gas diffusion, the individual gas molecules go from high to low and are driven by kinetic energy. A diffusion gradient is operated by the partial pressure differences of individual gases. Here, more than one gas can move at a time. Our fun equation to remember: respiratory exchange ratio. How much O2 goes into the pulmonary capillaries blood compared to how much CO2 goes out of pulmonary blood into the alveoli, which is 250 ml per minute of O2 compared to 200 ml per minute of CO2, or 0.8. The normal gas pressures. PvO2 equals 40. PvCO2 equals 46. PaO2 equals 100. PaCO2 equals 40. PaO2 equals 100. PaCO2 equals 40. The A's are 100 over 40 and the V is 40 over 46. Course of O2 from alveoli to the capillary. Step 1. O2 enters fluid layer of alveoli. Step 2. It passes through the alveolar epithelium. Step 3. It passes through the alveolar basement membrane. Step 4. It passes through the interstitial space. Step 5. It passes through the capillary membrane. Step 6. It passes through the capillary endothelium. Step 7. It passes through the plasma. Step 8. It passes through the erythrocyte membrane. Step 9. It passes through the intracellular erythrocyte fluid. Step 10. It finally binds to hemoglobin. Pulmonary disorders causing alveolar capillary thickness increase. Pulmonary edema. Pneumonia. Interstitial lung disease such as scleroderma sarcoidosis and Goodpasture's syndrome. ARDS. And RDS in newborns. Here is the alveolar thickening effects on diffusion. And here is how exercise is affecting diffusion. Perfusion limited is how. The gas exchange across the alveolar wall is determined by the amount of blood flowing past the alveoli. And the gas exchange across the alveolar capillary barrier is limited by the blood flow through pulmonary capillaries. This applies to N2O, which doesn't bind to hemoglobin. Diffusion limited is how. The gas exchange across the alveolar wall is determined by the integrity of the alveolar capillary membrane. And the gas exchange across the alveolar capillary barrier is limited by the diffusion process. This applies to carbon monoxide, which binds quickly to hemoglobin. Some diffusion-limited problems are shown below. The diffusion capacity of carbon monoxide, also known as DLCO, is the measurement of the amount of carbon monoxide moving across the alveolar capillary membrane to the blood. The normal rate is 25 ml per minute per mmHg. And below 25 equals emphysema. Affecting factors include the patient's age, lung volume, body size, exercise, alveolar PO2, hemoglobin concentration and carboxyhemoglobin. The hyperbaric chamber is used for O2 pressure therapy set greater than 1 atm, typically 1.5 to 3 times above. The main side effect is ear barotrauma caused by the pressure change. Restrictions for use include no perfume, deodorant, or jewelry. No drinking alcohol or carbonated beverages, as well as no smoking 4 hours before treatment. And only cloth clothing. Hyperbaric chamber indications. The main reason is because the increased 100% O2 promotes healing. It is used on patients with gas disorders such as gas embolism and decompression sickness, vascular disorders such as radiation necrosis, diabetic wounds, crush injuries, non-healing skin grafts, thermal burns and acute traumatic ischemias. Infections such as clostridial gangrene, necrotizing soft tissue infections and refractory osteomyelitis. And also for O2 transport disorders such as carbon monoxide or cyanide poisoning and severe blood loss or anemia. O2 toxicity can happen in 24 hours due to a high partial pressure of O2 or long exposure to AFiO2 greater than 50%. Some pulmonary effects are tracheobronchitis, substernal chest pain, atelectasis, and decreased vital capacity, lung compliance and diffusing capacity. Some CNS effects are tremors, twitching, convulsions, coma and death. The CNS effects can be caused by increased ATM, such as in the hyperbaric chamber.